I wanted to talk about some of the things in a brochure that's called Safer Sex for Trans Bodies. And first, I'd like to start out with the new definitions for body parts. So, I would say that much of this might be inappropriate for children. However, because trans activists are now going into schools and telling children that girls can have penises and boys can have vaginas, I don't know that there is anything inappropriate about what I'm going to say, because what I'm going to say is actually anatomically correct, whereas what these people are saying is pure fiction. So the first word they have defined is dick. And they say we use this word to describe external genitals. Dicks come in all shapes and sizes and belong to people of either gender. So my dick is actually called a clitoris. Male dicks are called penises. But now we have this gender neutral term called dicks. So men and women can both have dicks. A front hole. We use this word to talk about the internal genitals, sometimes referred to as a vagina. A front hole may lubricate depending on age and hormones. So a vagina is now called a front hole because a woman who identifies as a female is born with a vagina, but a man who identifies as female doesn't have a vagina. And so if he wants to have surgery, he can get a vagina made. But they call what biological females have a front hole. Strapless. This is my favorite. We use this word to describe the genitals of trans women who have not yet had genital reconstruction surgery, sometimes referred to as a penis. So guess what, guys? You no longer call it a penis. You call it strapless. And what this refers to is the idea that a trans man has to have a strap-on penis, whereas a biological male is born with a penis. So we don't want to suggest that a penis is anatomically connected with the biological male. So we're going to call it strapless. And a trans man would have a strap-on penis. And finally, we have the term vagina. So they actually have vagina on here. But we use this word to talk about the genitals of trans women who have had bottom surgery. So a trans woman who's had bottom surgery gets to call her hole a vagina. But the rest of us who are born anatomically female have to refer to it as a front hole. So it's important to know these terms because when I start reading to you about the effects of hormones on the human body, it's going to be important for you to know that a clitoris is a dick, okay? And that a vagina is only a term that we use if it's been medically constructed, not if you were born with it. And strapless refers to a penis, but only if it's the penis of a male who hasn't had surgery yet. I'm not sure about that one. So let me go on to some other information in this brochure. Common hormone-related changes. So when a female body is given testosterone, there's an increase of hair. The front hole becomes dry. What that means is the vagina, but we're not supposed to say that word. It's called a front hole because this is a woman who's identifying as a man. There, she doesn't have a vagina. She has a front hole, and her front hole becomes dry. Her dick grows. So again, that means her clitoris grows. She has an oilier skin, increased muscle mass, increased sex drive, growth of hair on the abdomen, and the voice deepens. So those are the hormone changes caused by testosterone. Androgen blockers and estrogen. This is what happens to the male body when given androgen blockers and estrogen. The decreased ability to maintain an erection on their strapless, I'm sure. A lower sperm count. Their testicles shrink. Their sex drive decreases. Their breast tissue grows. And they have a redistribution of fat. So these are the things that happen to biological bodies when they're introduced to the opposite gender sex hormones, which in theory causes them to become the other gender, even if they haven't had surgery, which is why we have to use these really strange terms. And now let's talk about the surgeries. One is called a trans feminine surgery. So this is for a man who wants to appear to be a woman. First of all, a breast augmentation. They can implant silicone to increase the chest size. This one is something that I find incredibly disturbing. It's called facial feminization surgeries and a tracheal shave. Oh. So basically, just they shave the Adam's apple to make it appear less prominent, and they actually will often have surgery to reduce the brow bones. So they actually go in and chip away the brow bones, and often they'll actually pull the hairline forward as well. And these are all things done to help a male appear to be more female. They will also often have contour surgeries, or orchiectomy, which is the removal of the testicles, peniolectomy, which is the removal of their strapless, and vaginoplasty, which is the creation of a vaginal structure. So they get a vagina instead of a front hole. So let's talk about transmasculine surgeries. First of all, they have a mastectomy, which means they remove the breasts of a healthy woman. A woman who identifies as a man. Often a hysterectomy is needed, and often this actually becomes medically necessary because if a woman is on cross-gender hormones, her uterus starts to atrophy and it can become incredibly painful. So having that hysterectomy is often not a choice but a requirement because it becomes so painful. A bilateral saphago-orectomy, which means the removal of the fallopian tubes, which again, this can become medically necessary if a woman's on testosterone. Vaginectomy, which is the removal of her front hole, not the vagina, the front hole. I'm probably gonna not say this correctly, metodiaplasty, which is to free her dick. Okay, let me start again. This is to free a dick exposed to hormones from the ligaments in the labia to let it hang lower. So basically what happens when a woman takes testosterone, her clitoris grows. They're calling it here a dick. So she develops a little tiny dick. And this surgery is to remove her clitoris so that it appears to be more like a strapless, otherwise known as a penis. And finally, a phalloplasty, which is to form a larger dick with an implant for creating an erection using skin grafted from the arm, back, or thigh. They actually take it looks incredibly painful. They take tissue from the arm to create a dick. We're not going to call it a penis because it's not a penis. We're not going to call it a strapless because it's not a strapless. We're going to call it a dick. So this surgery enlarges her dick. This brochure is specifically designed for transgender people. However, this is the language that's being used around our children to teach them about being transgender. So our children are going to be learning about genderless dicks. So basically anybody can have a dick, whether you're male or female. I have noticed that transgender females really like talking about their girl dick a lot and will often suggest if they're mad at you that you should suck their dick. And it's so confusing because at the same time as trans activists are trying to say that these body parts are genderless, they're insisting that they should have cosmetic surgery that helps them to present in a very gendered way. So if in fact body parts, sex parts, if in fact our I want to call them private parts, they're not private parts. If in fact our penis and vagina do not define our biology or our gender, then why is it that trans people need to have these surgeries to change their anatomy? Because if a dick can be genderless and a penis can be a strapless, and a vagina can be a front hole, then there really is no reason why someone who has gender dysphoria has to have dysphoria surrounding their sex parts, because according to trans activists, sex parts are genderless. So either our bodies are genderless and our sex parts are genderless, and in that case, none of these cosmetic changes are necessary for someone who identifies as the other gender. Or these sex parts are related to biology, and our biology does matter, in which case people who are gender dysphoric are having a mental health issue in that they're not connected with their body. They're experiencing dissociation and dysphoria as a result of their body parts. So it's one or the other. It can't be both. It's either a mental health issue or it's cosmetic. If it's cosmetic, then insurance companies certainly shouldn't pay for these surgeries. If it's mental health, they shouldn't pay for these surgeries either, because we never pay for functional bodies to become less functional. That's not what insurance companies do. In their attempt to decouple our sex parts with our biology and our gender, what they've actually done is shown how absurd the whole transgender movement is. Because if our sex parts don't mean anything and are genderless, there's no need for these cosmetic surgeries. The bottom line is, this is really convoluted. And if, as an adult, it's confusing. Imagine how confusing this is to little kids when they're told that their clitoris, which probably most girls don't even know that they have until they're a little bit older, is actually a dick and can be male or female. And when boys are told that their penis is actually called a strapless because it's not actually affiliated with being a boy. And little girls are told that if they want to identify as a boy, they can get a packer, which is basically a fake penis to put in their panties. But their clitoris is actually a dick, which is a genderless male sex part, or not, I'm not sure. So, as a child, imagine getting this information and trying to make any sense of it. I can't make sense of it as an adult. I can't make sense of it as somebody who even experienced gender dysphoria. I can't make sense of it. So I'm going to take my dick and go use the potty, and I can even purchase what's called a STP, I believe it's called, a stand to pee device, so that I can pee standing up with my dick, my wee little dick. And if I decide that I want a bit of a bigger dick, I can take testosterone. And if I want a really big dick, I can get a phalloplasty, which means that I can get the flesh of my arm sliced off and formed into a phallus. Non-functional, of course.